Sports injuries occur while participating in organized sports, competitions, training sessions, or organized fitness activities. According to the IOC Manual of Sports Injuries from 2012, a sports injury may be defined as damage to the tissues of the body that occurs as a result of sport or exercise. Overtraining, lack of conditioning, and inappropriate technique of performing a certain task lead to sports injuries. Neglecting to warm up prior to exercising or playing any physical sports also increases the risk of injuries. Common high injury risk sports are football or soccer, basketball, cricket, volleyball, skiing, and tennis. Sports injuries result from acute trauma or repetitive stress associated with athletic activities and can affect bones, soft tissues like ligaments, muscles, and tendons, or other organs like the heart, lungs, and eyes. Some of the more common sports injuries include bruises. A blow can cause small bleeds into the skin. Cuts and abrasions are usually caused by falls. The knees and hands are particularly prone. Concussion, mild reversible brain injury from a blow to the head, which may be associated with loss of consciousness. Symptoms include headache, dizziness, and short-term memory loss. Dehydration. Losing too much fluid can lead to heat exhaustion and heat stroke. Sprain. Stretching or tearing of ligaments, the fibrous tissue that connects bones and joints. Symptoms include pain, swelling, and stiffness. Strain. Stretching or tearing of a muscle or a tissue connecting muscle to bone. Symptoms include pain, swelling, and bruising. Dental damage. A blow to the jaw can crack, break, or dislodge teeth. Nose injuries, either blood nose or broken nose, are caused by a direct blow. Stress fractures, particularly in the lower limbs. The impact of repeated jumping or running on hard surfaces can eventually stress and crack bone. Sports injuries treatment is better dealt with the help of sports physiotherapy, which is the particular branch of physiotherapy that manages injuries and physical issues associated with athletes. The primary aim of physiotherapy in injury rehabilitation is to treat and fully rehabilitate the athlete post-injury or post-operation to prevent further injury and to make the athlete return to the sport within the shortest possible time. Sports physiotherapists have sports-specific knowledge and as such are better apt in helping the athletes make rapid recovery. A strong athlete-physiotherapist relationship is necessary for effective treatment and shaping of athletes' expectations of injury rehabilitation. The main goals of physiotherapy and rehabilitation in sports injury cases include planning exercise regimes to help return the athlete to pre-injury function at the functional site. Personalized exercise prescription is used to improve mobility restrictions. Preventive injury methods and diagnosis for athletes through a screening process and exercise. It helps achieve peak athletic performance. And of course, constant monitoring of the athlete. The role of physiotherapy in sports has expanded over the years. Sports physiotherapists provide a variety of services to support health goals. Along with managing a wide range of injuries and health issues, they prescribe exercise programs that utilize strength and cardiovascular training. The physical assessment performed by a sports physiotherapist is critical to achieving a customized exercise program. A sports physiotherapist is involved with sportspersons in various settings such as in clinics, with training and touring teams, and during competitions. The role and responsibility in each setting vary considerably. While the treatment of injuries and facilitating recovery from physical and psychological fatigue remains the major area of intervention. Lately, the value of physiotherapy in the prevention of injuries is fast receiving attention. Many times, the physiotherapist remains the only member of the medical team during competitions and tournaments, and it becomes their responsibility to identify medical emergencies and offer first aid. A therapist traveling with the team has the additional responsibility of looking after the common medical, nutritional, and psychological needs of the players, besides maintaining the optimum arousal level. The role of a physiotherapist varies in different settings. In a clinic, They aim to reduce symptoms, prevent recurrence, and blunt the effect of detraining. With the training team, they identify injury-prone athletes, design and implement preventive strategies, guide on warm-up, stretching, and conditioning, and facilitate recovery. For a touring team, they identify and manage common medical problems of the athlete, look after their medical and nutritional needs, reduce stress, maintain optimal arousal levels, and treat musculoskeletal injuries. At a competition venue, they identify emergencies and conditions requiring referral and provide first aid.